welcome back to my YouTube channel. For those of you who are seeing me for the first time, this is Rocha. And for your kind information, I have made several videos on mental health and nursing as it is my specialty. And in my previous video, we have discussed about nursing research, its characteristics, importance and purpose of nursing research, and mainly these videos are made in exam point of view so that it will be helpful for the students to go in detail as well as for the review purpose just before the examinations. So before we could proceed, I would like to request you all to please subscribe this channel and share these channels to others. For today's topic, we are going to discuss about research process. What is meant by research process? So under research process, we are going to discuss about introduction part of it, definition, phases of quantitative research, steps in quantitative research, steps in qualitative research, selecting quantitative and qualitative research, when we are supposed to select quantitative and when we are to select qualitative. So coming to exam point of view, Dr. NTRUHS, BSc Nursing 4YDC examinations as well as 2YDC examinations, most commonly asked question several times is explain the steps of research process. It is a 10 marks question, very important topic which has been asked in 2022. You can expect this question. It is an essay type. So in this video, as mentioned earlier, we are going to discuss in detail about research process. Coming to introduction, what is research and why is it important? We have gone through that in previous video. But as we say, nursing is a profession and the nursing practice is based on evidence. We call it as evidence-based practice. So as we render care to the patients or the clients, whatever care we are giving is based on a rational and an evidence. In order to provide quality care and an effective care, we need to have an evidence, that is research evidence. So according to American Nurses Association, research-based practice is essential if the nursing profession is to meet its mandate to society. So that's where nursing research plays an important role. So what is research process? How does it takes place? And what are the steps, various steps involved in research process that we are going to see in this video. Coming to definition, it is a systematic, logical, orderly way to obtain scientific knowledge through careful collection and scientific examination of data and empirical testing of hypothesis. In my previous video, I said when we use this term empirical, it means something which can be reevaluated, observed or seen, and the results will be the same when it is repeated again and again. So research process is systematic, logical, orderly, as it is followed in stepwise manner. And why we are doing this research is we want to obtain some knowledge through careful collection and scientific examination of data, because we send it, whatever data we gather, we send it for analysis. And this process follows sequential steps, and each steps consists of general flow of research activities. So those steps we are going to see in this research process. Now coming to phases of quantitative research. So one thing you have to keep in mind is we are going to go in detail of what is research process. We have 5 phases. First phase is conceptual phase. When we say conceptual phase means some description. what it includes. In order to get a concept of what is research, we need to do some things like reading, theorizing, conceptualizing, reconceptualizing, reviewing the data. So here the researcher, he will have some skills like creativity, inductive reasoning, deductive reasoning, insight. What is it? So in order to have this idea of concept, we need to go through certain steps like identify a problem, determine the purpose of study, review of literature, and we develop theoretical and conceptual framework, identify the study assumptions, what we assume, what are the limitations of the study, and we formulate hypothesis, and we define the study variables, that we call it as operational definition. So the conceptual phase includes from identification of the problem to operational definitions, and we go through this. Next, we go on with next phase, designing and planning phase. In this, the researcher makes a decision about what method and what procedures to be used to address the research questions. In designing and planning phase, what the researcher does, he uses different methods and procedures. That's where we call research methodology. So the steps which include here are select the research design, identify the population, then select the sample, specify the methods, how you want to measure the research variables, then developing some methods for safeguarding human rights, then conduct a pilot study. This phase ends by conducting a pilot study. Next, we move on to empirical phase. When we say empirical phase, as I have defined, something which involves observation. One of the most time consuming parts is empirical phase, where we approach the sample, we gather the data, what we require. So this involves collection of data and organizing the data for analysis. Compilation of data. Next we have analytic phase. Here analytic phase means whatever data we have gathered, we send it for analysis. We have descriptive analysis, statistical analysis, where the statistician just analyzes the data according to the objectives, hypothesis, and he will send the data interpretation, and we will interpret the data according to the hypothesis, according to what we have assumed, whether it is correct or not. Assumptions are involved in this. So data interpretation is done in this analytic phase. Then the last phase is dissemination phase. This is the final phase. That means whatever interpretation we have done, that has to be communicated. So this involves a communication of the findings to the public, concerned public, utilizing the findings. So these are all some of the phases of quantitative research. When you look at this table, you'll get the whole gist of what the research process means. So anyway, we will go in detail regarding the steps of research process. Now the first step of quantitative research process. So you need to differentiate what is quantitative and what is qualitative. So that we have discussed in our previous video. First step is identify the problem. This is very important. You have to identify the problem and clearly understand what is the problem. So you have to do a vast study, select a topic which includes broader area, then narrow it down to one sentence. And how you can get these problem statements? By just from the review of literatures, from personal experiences, or previous research studies what you have gone through, or from the theories, nursing theories, or sometimes it may be according to the interest of the researcher, or sometimes the problems, current problems what we face when rendering care to the patients, we can take topic from that also. So this is very important phase. Unless the problem what you have selected is of importance, or if it should be based on the current issues, or the problem what you select should be useful in the practice area or educational area or administrative area like clinical research. That is the first and foremost step. Next, moving on to the next step, determine the purpose of the study. So problem statement, once you frame, it will address what will be studied, for what it is studied, why the study is being done. So research purposes in this research is to explore, understand, investigate, identify, evaluate, find out, describe, interrogate. These are certain things where the purpose of the study, objectives, comes in place here. If the purpose of the study is clearly understood by you and presented and justified, it will be more easy for you to just convey why you feel the study is important. And when you try to convey, the approval also will be very easy from the ethical committees. For example, if you just consider a problem here, effectiveness of mind, body, spirit intervention on well-being of depressive patients. Effectiveness of mind, body, spirit intervention on well-being of depressive patients. A study to examine these variables might follow the purpose. What is the purpose? You want to explore the well-being of depressive patients, to develop and evaluate the effectiveness of psychosocial group intervention based on the integrated body, mind and spirit approach. So you have an idea like why on depression patients you want to do this study. The purpose is that body, mind and spirit, these are interrelated and interconnected. So you want to use this approach and see that when you just approach the depressive patients in all these areas, maybe you can find some improvement. That is your purpose. So you want to prove it. That is how you determine the purpose of the study. Next, coming to the third step, review of literature. When we say review of literature, it should be built on previous knowledge. Before beginning any quantitative study, it is very important to determine the information that is already existing about that topic, because it helps you to understand what researchers were done, what information they have disseminated, and it's going to help you out regarding selecting the conceptual framework, theoretical framework, what type of methodology they have used, what type of research designs they have used, and what are different types of variables they have selected to conduct the study, so that you may not replicate the same study, make some changes, so that you can find out something in addition to and add some additional knowledge to the previous study. Review of literature is very important at each and every phase of the research process. Then the next step is to develop a theoretical or conceptual framework. So the ultimate goal of doing any research is to develop scientific knowledge which will aid the nursing profession. to develop in all these fields like education field, administrative field, clinical field. Research and theory, these two are intertwined. Like research can test theories and as well as it will help to develop theories or refine theories. Thus, theoretical frameworks are valuable part of any research. So, this theoretical or conceptual framework also assists in selection of study variables and in defining them. And this framework also develops to formulate hypothesis and interpretation of the findings. So we have a separate subject as nursing theories, where many nursing theorists have had their own conceptual frameworks and theoretical frameworks, agent, host and environment. Based on that, different approaches they have used while giving the services to the clients in clinical areas as well as educational aspects. The next fifth step, okay, before going to fifth step, we have a picture here which clearly portrays the differentiation between theoretical framework as well as conceptual framework. You may not need to write as a whole on this part in your exam, but you need to understand what is theoretical framework, what is conceptual framework. When we can say it is theoretical, a point of focus for attacking the unknown in a specific area. When you're trying to find which is not known, then you use it as what? Theoretical framework. To explain the relationship of two or more variables, to test theories, to stimulate a research, establish connection between observation and facts. Derived from specific concepts and propositions that we are induced and deduced. So theoretical framework, if it is a new area, to establish a relationship, to test a theory, or to stimulate a theory, to establish some connections between observations and facts, and it is derived from specific concepts like propositions that are inductive and deductive, that we use it when we are reasoning. Next, coming to conceptual framework. Concepts are placed within a logical and sequential designs. So here we have like study variables will be there, pre-op, then intervention, then post-op. How do you manage? It's like that. So specific concepts and propositions derived from empirical observations to make research findings meaningful and generalization, to stimulate research and the extension of knowledge by providing both directional and inputs, to encourage theory development, and it is also used in practice. This is what theoretical and conceptual framework means. Now coming to the fifth step in research process, identify the study assumption. Assumptions itself means that we imagine, we assume, we believe something. It is not necessary that it should be always correct, it should be always be correct or proved. Assumptions are just beliefs. It might be true or it might not be true also. So assumptions, they influence the questions that are asked, the data that are gathered, method used for collecting the data or interpreting the data. Coming to assumptions, I hope you got an idea what assumptions are. When you believe something, you want to find out whether it is true or not. If you want to find out whether it is true or not, then you will have some things in your mind like how I am going to find whether it is true or not. In what way can I approach? And according to the answers what I get, should I say whether it is true or false? That's how it is like. We have different types of assumptions like universal assumption, theoretical assumption, and research based assumptions. Universal assumptions are beliefs that are assumed to be true by higher percentage in society. Higher people, I mean higher percentage. Most of the people believe that this is true. So when majority of people believe, we say it is universal assumption. Here we take an example like we have said uh, mind body spirit based intervention on depressive patients. That's how we have said like. So we believe that man is biopsychosocial being. We believe that body, mind, spirit are interrelated. Assumptions may be derived from a theory or previous research. In addition, the results of previous studies can also form the basis of assumption in our present or current research investigation. So here, for example, investigator conducting a study to evaluate the effectiveness of body, mind, spirit intervention among depressive patients. Universal assumption is that depressive patients will have bodily problems, mind problems, and spiritual problems. When a person is suffering with depression, we assume that he is having mentally fatigue, he suffers with physical problems like lack of appetite, loss of appetite, and insomnia, etc. Restlessness, all those interrelated, body, mind, and spirit, all these are interrelated. That's how you assume. And then you try to provide an intervention using these three dimensions: body, mind, and spirit. That's where you get this body, mind, spirit intervention on depressive patients. So, assumptions are beliefs, but they are very useful for you in making a problem statement, trying to find an answer for the problem by yourself, and how you're going to interpret and what type of interventions you are going to provide. Next, coming to the next step, acknowledge the limitations. The word limit itself means setting some boundaries. We have different types of variables, independent variables are there and dependent variables are there. Limitations are uncontrolled variables that may affect the study. We have limitations and delimitations. There are certain limitations where we try to limit the study. But when coming to limitations, these are certain variables which are not under the study or which are not controlled. And if they are not controlled, the study results may affect the generalization of the findings. There are two types of limitations like theoretical limitations and methodological limitations. Now, for example, delimitations means where researcher sets for himself, I am going to do my study on this population, select my sample in this area, limit my sample size to this. These are certain things what you do. Delimitations. But coming to limitations, you may not expect them to come over when you're doing certain studies. So there are two types, namely theoretical and methodological limitations. So almost in all nursing studies, these variables over which researcher either has no control or chooses not to exercise control. These variables, extraneous variables. For example, if you are doing some study as mentioned previously, like body, mind, spirit based intervention on depression patients, you might select a sample and try to do, but you really do not know their educational level regarding this mind, body, spirit interventions. If they had some previous knowledge, it might affect the study, but until and unless you get the results or when you interpret the results, you will not be able to guess it. Study will be conducted, but some might be there who already had a previous knowledge about studies. So these are said as like limitations of the study. They influence the study. In experimental studies, uncontrollable variables are referred as threats to internal and external validity. The next seventh step is like formulate the hypothesis of research question. So hypothesis means it predicts a relationship between two variables, independent variable and dependent variable. So you might say there might be a significant relationship or there is no significant relationship. Here it predicts a relationship between one or two or more variables, whereas the problem statement asks a question. A study to evaluate, it asks a question. Relationship between something, independent variable, dependent variable. Hypothesis furnishes the predicted answer to the question. Null hypothesis says there is no significant relationship between the variables. Research hypothesis furnishes the predicted answer. You have an assumption, okay, this body, mind and spirit is intertwined or interrelated. So the depression patients might be suffering with these problems. So this is your assumption. You say there will be a significant difference in depression patients after providing these mind, body, spirit based interventions. So hypothesis contains a population and a variable, just not a problem statement. It also proposes a relationship between independent variable and this is dependent variable. Next, coming to the following step after hypothesis is define study variables. So when we say define study variables, the variables what we are using in the study or the hypothesis or research question needs to be defined. Their meaning in general might be different. Dictionary meaning will be different. Theoretical definitions will be different from the literature sources according to the study what we do. But we are supposed to provide operational definitions. Operational definition indicates how a variable will be observed or measured. So when we use these variables in our study, we are going to give a clear understanding or a clear picture of what we mean by selecting those variables. How we are going to measure those variables, independent variables and dependent variables. Next, the next step is select the research design. What is a research design? It refers to the researcher's overall plan for obtaining answers to the research questions and it testifies the research hypothesis. Research design, it uses methodology, what type of data we are going to collect, how the data is going to be collected, what type of tools we are going to use, what type of designs we are going to use, and how the data will be interpreted. The researcher chooses the design that is most appropriate to the study hypothesis to answer a research question. So these designs can be categorized as quantitative or qualitative. They can be categorized as experimental or non-experimental. So when we say experimental designs, then we go into true experimental design, quasi-experimental design, pre-experimental designs. There are so many actually. We can go in detail regarding those experimental research design later. We have non-experimental designs which include description, comparative studies, relation studies which find the relationship between the variables. The next step following this is 10th one, identify the population. Population means the complete set of individuals or objects that possess some common characteristics of interest of the researcher. So we say like adolescents. It is a population. But if we are selecting adolescents in a particular area with a setting, then it might become a sample. So when we say population, it is a broader term, targeted population, which age, and we have an accessible population who are available at the during the study period. From the population, we select a sample. So sample is the subset of the population that is selected for the study. And this sample, whatever we chose, which represents the population, and this sample which is used can be made or used for generalization of the findings about the population what we are selecting. It may be adolescent, older women, men, or whoever it is, patients or suffering from certain conditions, whoever it is. Next, coming to the 12th step, that is specify methods to measure the research variables. So quantitative researcher must develop methods to measure research variables. So how do we measure? By using some data collection approaches or psychological measurements, psychosocial measurements, like rating scales, self-reports, observations, etc. We have some methods like collecting, like doing some interviews, surveys, etc. Next, coming to the next step, developing methods for safeguarding human rights. So because nursing is related to human beings and they have these cognitive abilities to rationalize, to think, and they possess some rights, they have some freedom, they can choose whether to consent or not. And as we are dealing with lives, we should respect their rights and see that we do not cause any harm to them. There comes the safeguarding of human rights. Ensure that the rights of the subjects are rigorously protected through all phases of the investigation. We cannot invade into the privacy of the patients. That's where we have to present our study in front of the ethical committee, and we need to get an approval of the ethical committee. Our study should respect the rights of the person and it should follow the ethical principles. Next, coming to the next step, conduct a pilot study. Pilot study is a miniature of the study what we want to conduct. in large. Suppose if we want to do a study on 100 or 200 population, maybe we can take 10% of the group, conduct a study on 10 or 20 and see how the study is going on, gather the data, interpret the data, and see where all the corrections, where all the problems lie and corrections need to be done, whether it is feasible or not, whether the study is going according to your assumptions or not. So pilot study in a way helps you a lot before proceeding with the study on the larger group in all steps of nursing process. You can refine your conceptual frameworks or your data gathering tools, research designs, methodologies, all these can be refined or rectified with the help of conducting pilot study. Next step is collect the data. Pieces of information or facts collected during this investigations or research is called data. Through data collection procedures, the study variables can be measured. And when you are collecting data, it should be systematic, logical, and orderly form. For example, in experimental data, non-experimental, you do follow certain processes. Next, coming to organizing the data for analysis. After getting the raw data, you need to put the data or you need to tabulate the data for evaluation. And you need to have an understanding how I am going to compile this data. Put tables. You need to categorize the data. And once you start compiling the data and putting them on the tables, you will identify that there is a missing data. And you will try to make a decision regarding that missing data. What am I supposed to do with the missed data? You need to collect more data from more samples. If large amount of information is missed, you cannot use that sometimes. So you will have an idea of what to do. If you are interviewing and tapes are being recorded, then the tapes have to be analyzed. Then whatever the person interview says, like, you have to write them in a written form, convey their feelings, objective as well as subjective data. Then this data is sent to a statistician. Before we could organize this data, it is always safe and good to approach a statistician, because he will guide you and help you out how you can collect data from the research sample and which way is the best way to collect and how you can tabulate the data whatever you have gathered. This is how, like, a statistician will help. And during interpretation also, if you tell about the study, he will try to analyze the data according to your research hypotheses and assumptions and what type of statistical analysis he needs to do. So this 16th step, organize the data for analysis, you need to approach a statistician. It is always good. Next, analyze the data. Analysis data consists of putting all the individual observation scores, measures or interview data into manageable form. So the data should be analyzed in terms of stated problem. The questions posed, findings should answer the questions. hypothesis will be stated, and the findings or the interpretations, okay, whatever findings what you got, whether they are supporting the hypothesis or not supporting to the hypothesis. So here the data can be like analyzed by using different types of graphs, bar diagrams or line diagrams, where you can get an idea of what data what you have gathered in a summary format. Next, interpretation of the findings. The data findings should be interpreted in the light to study the hypothesis is one, the research question, where the hypothesis is tested, whether it is proved or not, or null hypothesis is proved, whether the data supports it or not. If once the hypothesis, research hypothesis is supported or proved, then automatically what happens is the conceptual framework or theoretical framework what you used to conduct this study is also supported. The next step is communicate the findings. So this is very important and most important step because you will take all the strain of formulating a problem, operational definitions, hypothesis, assumptions, conducting the study, analyzing and interpreting. What is the use when others don't know? So whatever results you get, whatever other findings, they have to be communicated or otherwise disseminated to the other colleagues, and we have an access like different journals are there, presentations are there, you can present your study in your conferences and poster sessions, you can do exhibition and some local gatherings. These research findings can be communicated. The research will be complete only when the findings are communicated or disseminated. So 20th step, and this is the final step, utilize the findings. Once the results or the findings are communicated, you should also have a plan like the study, what you have done, whatever findings you have got. We said there are 3 areas like nursing education aspect, administration aspects, as well as clinical areas. How the study can be useful. So is this a picture here? It's a new treatment for dementia. Or something you try to find out, you communicate. I did a study on this. This can be useful. So I found out this. So it can be useful. That's when whatever findings you got will be put into practice. So I have explained regarding this research process in very detailed form, I think. Usually we can just summarize it into 10 steps or 20 steps. But it is always better because this is an essay question and it will be easier for you to remember as well. So this is all about quantitative research. Now coming to steps in qualitative research process, we are not going to go in detail. I'm not going to explain, but this qualitative research also uses the same steps as quantitative research, but only the method of collecting the data, the research design and interpretation of results, and the tools what you use are a bit different. So here it starts with review of literature, research problem, then research method, ethical clearance, and the type of sampling, data collection tools. Then you conduct a pilot study, gather data, data analysis, validation and verification. Difference between quantitative and qualitative research. Sometimes it can be asked for 5 marks question. So we can differentiate them according to purpose, design, approach, tools, sample, and analysis. Coming to quantitative research, to study relationships, cause and effect. Coming to qualitative, to examine a phenomena as it is in rich detail. Coming to design, developed prior to study. Because if it is an experimental or quasi-experimental or pre-test or post-test or any other Solomon 4-group design or correlation, etc. It is developed prior to study. But whereas in quantitative research, it is flexible. It can evaluate during the study. Approach, deductive test theory. Coming to qualitative, it is inductive and may generate theory. Coming to tools, uses pre-selected instruments for measuring things. And coming to qualitative tools, researcher is the primary data collection tool because he is going to participate in observation or interview or what. Participant observation and interviews. Coming to sample, uses large sample, but whereas qualitative uses small sample because sometimes it may be interviewing or sometimes case studies or cohort studies, observing a phenomena, culture, lifestyle, etc. Next, coming to analysis, statistical analysis of numerical data. But whereas in qualitative studies, it is a description or an observation, interpretation of themes. These are few differences, even though it's not a part of research process, but just to have an understanding, we have discussed on this. Selecting quantitative versus qualitative research. When you have to select quantitative and when you have to select qualitative research. This is also just for an understanding, just to have a little more knowledge. It is found that little is known about this phenomena. The researcher want to get a more holistic sense of their experience. Then select what? Qualitative study. If it is about a phenomena which you have only a little knowledge and you want to find more, then you go for what? Qualitative study. If the substantial knowledge already exists, then you have to go for quantitative design. If the purpose is to gain in-depth understanding or overall phenomena, then go for qualitative. If you are interested in learning cultural patterns, culture, Western culture, Indian culture, African culture, or any other thing, lifestyle of different groups or cultural patterns, then you should use ethnographic method. If you are interested in understanding human experiences, then you should use phenomenological methods, research methods. If you are interested in uncovering social process, then use grounded theory method. If you are interested in capturing unique stories, then you go for case study method. If the purpose of the study is to describe the relationship between specific variables, then you use descriptive design. If your intention is to test how an independent variable is affecting the dependent variable, then you go for experimental designs. So some elements of control are missing, then you go for quasi-experimental design. So these are different types of methods where you can use this study, and this is the end of research process. So I would like to just summarize the topic Today we have discussed about nursing research and the steps involved in nursing research. The different phases of nursing research also we have discussed. Steps involved in quantitative research, differentiation between qualitative research and quantitative research, and what type of research methods or types of researches which can be used according to our intentions, what we want to study. I hope I made it very clear, and I hope you have understood. And pretty soon we will meet again. This time it's going to be on a very, very important topic, repeated several times. It's about review of literature. Till then, bye bye. And before you just move off this channel or go off this channel, please don't forget to subscribe this channel and share to others. Thank you all very much once again. Bye.